వయసు ఎంత? వయసు 45. సో వీ హ్యావ్ గాట్ అ 45-year-old woman who has come to us with ఏం ఇబ్బంది మీకు? పొట్ట ఉబ్బింది. బస్ దట్స్ ఆల్. నొప్పులు. వేరే ఏమి ఇబ్బంది లేదా? వేరే ఇబ్బంది లేదా? పొట్ట బిర్రుగాటం అండ్ ఏమైనా ఆయాసం? అచ్చా, ఆయాసం ఎప్పటి నుంచి? 1 సంవత్సరం నుంచి మీకు ఆయాసం. ఓకే, సో వీ గాట్ దిస్ 45-year-old woman with షార్ట్నెస్ ఆఫ్ బ్రెత్ ఇన్ 1 year అండ్ బాగా దూరం నడుస్తూ ఉంటుంది. సో కైండ్ ఆఫ్ విత్ ఇంక్రీజింగ్ విత్ ఆర్డినరీ ఫిజికల్ యాక్టివిటీ. సో NYHE2. So why is she having that? So we did the echo and then see what we found. Now it's become a beautiful picture. See, this is our probe here. This is chest wall. And you can see a black thing here. Now what will most people think this is? Yes, very good. This people will think that it's a pericardial effusion, but this is not. This is actually a fat, epicardial pad of fat. This looks like a pericardial effusion, but because of all these fat that she has,
fat is hypointense only.
It looks hypointense. I mean, not, you don't call it hypointense, you call it hypoechoic. So hypoechoic, but how do you differentiate? See, there are some small gimlets of things coming here. Small white dots, which you won't see in a anechoic lesion, perfect anechoic lesion. So this is a very classical visceral fat, epicardial fat on top of the heart, and this is right ventricle, and this is the interventricular septum, which Dr. Durga Krishna thought could be the asymmetric septal hypertrophy of hypertrophic cardiomyopathy. But because we were phenotypically biased by looking at her parotidomegaly, her abdominal obesity, and it all goes with her heart failure symptoms, we knew that it was unlikely to be hypertrophic cardiomyopathy. So with that bias we did the echo, and sure enough our bias proved us right that it is basically just a concentric LVH and most likely due to a metabolic syndrome. And you can see the aortic root here, the left atrium here, the anteromytral leaflet there. Yeah, that is the right ventricle. That's the right ventricle. And the left atrium could be slightly dilated, which is expected because increased LV-EDP. And this is what is the classical feature of HFpEF, heart failure with preserved ejection fraction. So she has preserved ejection fraction, no failure that way, systolic failure, but it's a diastolic failure. How is the diastole failing? That is very difficult for most people to tell. How there is diastolic failure here. See, now I have done it 90 degrees. Now look at the coconut. You can see the coconut?
It's aorta.
90 degree. No, it is the left ventricle. The same thing, see the coconut in longitudinal is looking like this. When I cut the coconut, see like here, look at this.
Short axis.
Like this short axis. This is what the coconut looks like. So left ventricle. In the cross section. This is left ventricle, this is right ventricle here. Okay. And now you can also look at the aorta here. So this is the aorta. There are the 3 aortic valves you can see very well. And this is the left atrium. This is left coronary artery. Look at this. Left coronary artery. And this is the right coronary artery here. And the 3 aortic valves. There's some calcification in the tip of the valves. So there is some aortic valve sclerosis as well. And there's the main pulmonary artery, as you can see. Main pulmonary artery involves pulmonary valves, right and left. Okay. Now we go to the apical 4th chamber. See, we've gone to the apical 4th chamber. The left atrium, left ventricle again. This is the aorta, and this is the right ventricle, tricuspid valve.
So here we are seeing 4 chambers from the front, like no cutting, no.
Yeah, this is from apex. Yes, it is like
from down.
This is the apex from down. You are saying, yeah, right. Exactly. And you can put the color and see a bit.
Regurgitations.
Yeah, if there are any. See the aortic
blue
forward
is
flow.
regurgitation.
No, red and blue is like, you see the color coding is there. Up towards the probe is red.
Okay.
Away from the probe is blue.
Okay.
So that is all. And so if there is a turbulence like a regurgitation or even sometimes a stenosis, it's on the rib, I think. Rib lo vaste alaga noppi untundi. So that's what I mean. If you could see a turbulence, if there is aortic stenosis, you could see a turbulence here, there is aortic regurgitation. So there is none. So I am letting it be here.
What will a turbulence look like, sir, in the colors?
It will look like a mosaic pattern. A mosaic of red and blue. Nice, we will show you.